Two people, same age, same cancer. One survives. One does not. The difference between them was not money. It was not luck. It was not even which doctor they saw. It was one thing, how early they knew what to look for. That is what this video gives you. And it starts right now. What is pancreatic cancer? Every year, hundreds of thousands of people are told they have pancreatic cancer. And almost every single one of them says the same thing. They had no idea. They felt fine. They were going to work, taking care of their families, living their lives completely unaware that something was already growing inside them. By the time they sat down in that doctor's office and heard the word cancer, the disease had already been there for months, sometimes longer. And for most of them, by that point, the window to do something meaningful about it had already closed. That is not a rare story. That is the story of most pancreatic cancer patients. And understanding why that keeps happening, over and over again, is the entire reason this video exists. So let us start at the beginning. Where is your pancreas? And what does it actually do? Your pancreas is a small organ, roughly 6 inches long, sitting deep inside your abdomen, tucked behind your stomach and in front of your spine. Most people never give it a second thought. Most people could not point to it on their own body if you asked them to. And that invisibility, that complete lack of awareness, is part of what makes this disease so devastating. The pancreas has 2 jobs that your body absolutely cannot function without. The first is producing digestive enzymes, the chemicals that break down the food you eat into nutrients your body can actually absorb. Without these enzymes, food passes through you, without feeding you. The second job is producing insulin and glucagon, the hormones that keep your blood sugar balanced. When your pancreas is working the way it should, you never notice it. You eat, you digest, your blood sugar stays stable, and life carries on. But when the pancreas starts to fail, and with pancreatic cancer, it fails quietly and slowly, the consequences ripple through nearly every system in your body. Pancreatic cancer starts when cells inside the pancreas begin behaving abnormally. Instead of doing their job and then dying off the way healthy cells do, these mutated cells start multiplying out of control. They form a tumor that grows silently, pressing on nerves, blocking ducts, disrupting digestion, and eventually pushing into nearby organs. And because the pancreas sits so deep inside the body, completely hidden from the outside, you cannot feel any of this happening. There is no lump you can discover in the shower. No visible swelling. No clear, undeniable sign that anything has changed, until the tumor has grown large enough to cause serious, sometimes irreversible, damage. Now here is something most people do not know. After the age of 45, the rate of pancreatic cancer diagnosis spikes noticeably. And this is not random, it is biology. As the body moves past 45, several things start changing at the same time. The immune system, the system responsible for finding and destroying abnormal cells before they can become tumors, begins losing efficiency. It becomes slower to detect problems, slower to respond, more likely to let a mutated cell survive and keep dividing when it should have been caught and eliminated. At the same time, decades of cellular damage start accumulating. Every year of exposure to inflammation, to alcohol, to processed food, to smoking, to stress, all of it leaves microscopic damage inside the body's cells. The DNA repair mechanisms that protect against cancer become gradually less effective. By the time someone reaches their late 40s or 50s, the combination of a slowing immune system and years of accumulated damage creates exactly the kind of environment cancer needs to establish itself. This is why 45 is not just a number. It is a biological threshold, the point where the body's natural defenses are measurably weaker, and the conditions for abnormal cell growth are measurably better. And after 45, that risk does not level off. It keeps climbing. There are 2 main types of pancreatic cancer, and the difference between them matters. The first, and by far the most common, is called exocrine pancreatic cancer. More specifically, pancreatic ductal adenocarcinoma. This type accounts for more than 90% of all pancreatic cancer diagnoses. It develops in the cells lining the ducts that carry digestive enzymes out of the pancreas. This is the aggressive, fast-moving type responsible for the devastating survival statistics that most people associate with this disease. The second type is called endocrine pancreatic cancer, or pancreatic neuroendocrine tumors. These develop in the hormone-producing cells of the pancreas. They are rarer, tend to grow more slowly, and generally carry a much better survival rate. When you hear a story about someone who survived pancreatic cancer long-term, it is usually this type. This video is about the first type, the exocrine type, the one that spikes after 45. the one that hides, the one that kills. Now for the number most people do not want to hear, but need to. The overall 5-year survival rate for pancreatic cancer sits at around 12%. That means out of every 100 people diagnosed, only 12 will still be alive 5 years later. When caught at stage 1, that survival rate jumps to over 80%. When caught at stage 4, which is when the majority of patients are actually diagnosed, it collapses to under 3%. The cancer does not get more deadly at stage 4. It was always that deadly. The difference is simply time, and time is precisely what this cancer is designed to steal, one dismissed symptom at a time. Why it hides. If pancreatic cancer sent one clear, undeniable signal early on, a sharp shooting pain, a visible lump, something that stopped you in your tracks, most people would catch it in time. The surgery would happen. The treatment would work. The survival rate would look completely different. But that is not how this cancer operates. It is not loud. It does not announce itself. It grows patiently, disguises itself brilliantly, and by the time it finally makes itself impossible to ignore, it has already been there for months, sometimes years. Understanding why it hides so effectively is not just useful information. It is the difference between catching it early and never getting the chance. Place your hand flat against your stomach, just below your rib cage. Now imagine pushing that hand through, past your stomach, past your intestines, all the way back to your spine. That is roughly where your pancreas lives, deep, surrounded on every side by other organs, completely unreachable from the outside. This location is the first reason pancreatic cancer hides so well. Unlike breast cancer, where a tumor can be felt through the skin, or colon cancer, where bleeding creates a visible warning sign. A tumor forming inside the pancreas has no physical way to make itself known from outside the body. You cannot feel it. Your doctor cannot press on your abdomen and find it. It sits in one of the most protected and inaccessible spaces in the entire body, growing quietly without triggering any external alarm. And because the pancreas is surrounded by so many other organs, the stomach, the liver, the small intestine, the spine, when it does eventually start causing discomfort, that discomfort feels like it is coming from somewhere else entirely. The pain gets blamed on the back. The digestive problems get blamed on something you ate. The body's own geography works against early detection at every turn. But the location problem is only the beginning. Here is what makes this cancer genuinely extraordinary at hiding. Every single early warning sign it produces looks exactly like something ordinary. The back pain feels like bad posture, or an old injury. The fatigue feels like stress, or too many late nights. The weight loss feels like your diet finally doing something right. The digestive discomfort feels like something you ate disagreeing with you. The loss of appetite feels like a busy week. Every symptom comes with a perfectly reasonable, completely non-threatening explanation, and the human brain will always reach for the least frightening option first. This is not a failure of intelligence. It is how the mind protects itself. When something feels off, the brain searches through a catalog of possible explanations, and almost always picks the one that requires the least action and causes the least fear. A person who has spent 10 years sitting at a desk does not think pancreatic cancer when their back hurts. They think they need a better chair. Pancreatic cancer exploits this tendency completely. Its early symptoms are so common, so easily explained away, and so similar to everyday complaints, that even the most health-aware people dismiss them for months. By the time the symptoms become truly impossible to explain away, severe jaundice, dramatic weight loss, acute pain, the cancer has already moved well beyond its early window. The chance for intervention that would have actually changed the outcome has already passed. Now consider this. If you are a woman over 40, you are encouraged to get a mammogram. If you are over 45, a colonoscopy is recommended to screen for colon cancer. These tools exist for one reason. They find cancer early, before symptoms appear, before it spreads, while treatment can still change the outcome. Pancreatic cancer has nothing equivalent. No standard screening test. No routine scan. No simple blood test your doctor runs at your annual physical to check on your pancreatic health. A person can see their doctor every year without fail, pass every standard test, receive a clean bill of health, and still have pancreatic cancer growing silently inside them. Because nobody looked. There is a blood marker test called CA19-9 that can sometimes indicate pancreatic cancer activity. But it is not reliable enough to use as a routine screening tool. It misses early cancers entirely. It can be elevated by conditions that have nothing to do with cancer. It is useful for monitoring patients who have already been diagnosed, not for catching new cases early. Researchers are actively working on early detection tools, blood tests that can detect cancer DNA, advanced imaging, AI-assisted diagnostics. But right now, today, none of these are available as standard care, which means the only early warning system most people have is knowing what to look for themselves. And even when someone does notice something and finally decides to see a doctor, the system creates another layer of delay that most people do not realize exists. A typical doctor's appointment is 10 to 15 minutes long. In that time, a patient mentions one or two things. The doctor sees a person who looks generally healthy, whose symptoms each have a straightforward explanation, and treats what is directly in front of them. The back pain gets a physiotherapy referral. The fatigue triggers a blood test for iron. The digestive issues get an antacid prescription. Each symptom is treated as its own isolated problem. Nobody connects the dots. This is not a failure of individual doctors. It is a failure of how symptoms get reported and how appointments are structured. Most patients do not walk in and say, "I have had back pain, unexplained fatigue, weight loss, and digestive changes all at the same time for the past 3 months." They mention one thing. They downplay the others. They do not want to seem like they are being dramatic. And so the cancer waits, hidden behind ordinary-looking symptoms, buried deep in the body, protected by the absence of screening and the structural limits of a short appointment. This is exactly why knowing the warning signs yourself before you are sitting in that room is not optional. It is essential, because when you walk in, you need to be the one connecting the dots. You need to be the one asking the right questions. And you need to do it early enough for those questions to still change something. The 10 warning signs. Everything you just learned about why this cancer hides, the location, the mimicry, the absence of screening, makes what comes next the most important part of this video. Because while pancreatic cancer is extraordinary at disguising itself, it is not completely silent. The body does send signals. They are quiet. They are easy to dismiss. But they are real. And knowing them, recognizing them early, and taking them seriously before they escalate is the single greatest advantage you have. Read these not as a list of things to be afraid of. Read them as information your body may already be trying to give you. Sign number 10. Unexplained weight loss. You step on the scale, and the number is lower than last time. Nothing has changed. You have not been dieting. You have not been exercising more. Your routine is exactly the same, but the weight is coming off anyway. For most people, this feels like good news. Unexpected weight loss without effort feels like a reward. So they say nothing, do nothing, and enjoy it. Here is what is actually happening. When a tumor is growing inside the body, it does not sit there passively. It actively competes with your body for nutrients and energy. It consumes resources that should be fueling your muscles, your organs, your daily function. The weight loss has nothing to do with lifestyle, and everything to do with something taking from your body without permission. Losing more than 5% of your body weight over 6 to 12 months without changing anything is not a gift. It is a signal. Write the number down. Track it. And if it keeps dropping without explanation, bring it to your doctor with a specific question. I have lost this much weight in this amount of time without trying. I want to understand why. Sign number 9. Upper abdominal or mid-back pain. This pain does not arrive dramatically. It does not double you over. It is a dull, persistent ache, somewhere in the upper abdomen or radiating into the mid-back, that comes and goes without an obvious cause. It tends to feel worse after eating. It sometimes eases slightly when leaning forward. Most people live with it for months, cycling through explanations. Bad posture, old mattress, too much sitting, a muscle they must have pulled. What is happening is the tumor pressing against the dense network of nerves sitting directly behind the pancreas. As the tumor grows, that pressure increases. The pain travels along the nerve pathways into the back. It is not a muscle problem. It is not a posture problem. It is your nervous system transmitting a signal from deep inside your abdomen. Back pain that does not respond to rest, to painkillers, or to physiotherapy after several weeks, especially when it sits alongside any other sign on this list, deserves more than another hot water bottle. It deserves a proper investigation. Sign number 8. Jaundice. Jaundice is one of the more visible signs on this list, but people still miss it, especially in its earliest stages. It appears as a yellow tint to the skin or the whites of the eyes. It often shows up in photographs before the person notices it in the mirror. It frequently comes with very dark urine, the color of strong tea, and pale, almost chalky stools. The reason is mechanical. The pancreas sits directly beside the bile duct, the tube that carries bile from the liver into the digestive system. When a tumor grows at the head of the pancreas, it presses against or blocks that duct. Bile backs up into the bloodstream. The yellow pigment it contains begins depositing in the skin and eyes. Jaundice is never something to watch and wait on. The moment you or anyone around you notices a yellow tint in the skin or eyes, That is a same-week doctor visit. Not next month. Not after the holidays. This week. Jaundice caught early enough can still mean surgery is on the table. Jaundice ignored is time given directly to the cancer. Sign number 7. New onset diabetes after 45. This is one of the most deceptive signs on this list because it arrives wearing a completely different label. A person goes to their doctor, gets a blood test, and is told they have type 2 diabetes. They receive medication, dietary guidance, and follow-up appointments. The diabetes becomes the entire focus. Nobody asks what caused it. But research shows something important. In a significant number of pancreatic cancer cases, a sudden diabetes diagnosis, particularly in someone over 45 with no family history, no obesity, and no clear lifestyle cause, is not the primary problem. It is a symptom of the primary problem. The tumor is disrupting the insulin-producing cells of the pancreas, causing blood sugar to spike. Diabetes is the body's way of reporting that the pancreas is under attack. If you have been recently diagnosed with type 2 diabetes after 45 and it does not fit your history or lifestyle, ask your doctor specifically about your pancreatic health. Ask for an abdominal ultrasound alongside your diabetes management. Do not let the diabetes diagnosis be the end of the investigation. In this situation, it may only be the beginning of one. Sign number 6. Digestive problems and fatty stools. This is the sign most people are too embarrassed to mention to their doctor. The stools become pale, greasy, foul-smelling, and float in the toilet instead of sinking. Digestion feels persistently off. Bloating and discomfort after meals become regular. Foods that never caused problems start feeling heavy and difficult. The reason is straightforward. The pancreas produces the digestive enzymes needed to break down fat. When a tumor interferes with enzyme production, or blocks the ducts carrying those enzymes into the digestive system, fat passes through the body undigested. The result is exactly the kind of stool described above, and it is one of the body's clearest early signals that the pancreas is not functioning the way it should. If you have been noticing this and quietly dismissing it, stop dismissing it. Describe it specifically to your doctor. Use the exact words. Pale, greasy, floating. Those 3 words together paint a picture a trained doctor takes seriously. Sign number 5. Loss of appetite. Food stops being appealing. Portions that felt normal now feel overwhelming. Eating starts feeling like a chore. Favorite meals lose their appeal completely. Most people chalk this up to stress, a busy period, or simply getting older. They eat a little less, lose a little weight, and never connect the change to anything medical. The pancreas plays a direct role in regulating the hormones and enzymes involved in hunger and digestion. When a tumor disrupts that system, the hunger signals weaken. Eating becomes uncomfortable because the digestive system is already under strain. The loss of appetite is not in your head. It is physiological, your body pulling back from a function it can no longer perform properly. A persistent loss of appetite lasting more than 2 to 3 weeks, especially alongside weight loss or digestive changes, is worth reporting early, not explaining away. Reporting. Sign number 4. Extreme and unexplained fatigue. This is not the kind of tired that a good night of sleep fixes. This is a deep, heavy exhaustion that settles into the bones. Getting up in the morning feels like a physical task. Things that used to be easy now feel draining. The tiredness has no proportion to the activity level. Rest does not restore it. Cancer fatigue works differently from normal tiredness because the cause is different. The body is directing enormous amounts of energy toward fighting the tumor, running immune responses, managing inflammation, attempting cellular repairs. At the same time, disrupted digestion means nutrients are not being absorbed properly, starving the muscles and organs of fuel. The result is a fatigue that sleep alone cannot touch. If you have been exhausted for weeks without a clear reason, and especially if that exhaustion comes alongside any other sign on this list, do not normalize it. Unexplained fatigue is one of the earliest signals the body sends when something serious is developing internally. Sign number 3. Persistent nausea. Occasional nausea is part of life. But nausea that keeps returning, day after day, week after week, without any clear cause like illness or a new medication, is something different. It sits in the background persistently. Sometimes it leads to vomiting. Sometimes it is just a constant, low-level queasiness that never quite goes away. A growing pancreatic tumor can press against the stomach, or the first section of the small intestine, partially blocking the normal movement of digested food. The result is backed-up digestion, internal pressure, and persistent nausea. Many people manage this with over-the-counter antacids for months, treating the symptom while the underlying cause keeps progressing. Nausea that comes back consistently over several weeks, with no obvious trigger and no response to standard remedies, needs to be investigated, not indefinitely managed with antacids. Sign number 2, unexplained blood clots. A swollen, painful, warm, or red area in the leg, sometimes the arm. A deep vein thrombosis, commonly known as a DVT, that appears without any obvious cause. No long flight, no recent surgery, no clear explanation. It gets treated as a standalone event, blood thinners are prescribed, and nobody investigates what triggered it. Pancreatic cancer has a well-documented connection to abnormal blood clotting. The tumor releases substances into the bloodstream that make blood thicker and more prone to forming clots. For many patients, an unexplained blood clot is one of the earliest detectable signs that something malignant is present. But because it is treated as its own separate condition, the connection is rarely made early enough to matter. A blood clot in someone over 45 with no obvious risk factor should always open a deeper conversation with a doctor about what else might be happening. Sign number 1, itchy skin with no rash. This is the sign that gets dismissed most consistently and ignored the longest. A persistent widespread itch, all over the body, or concentrated on the hands, feet, and torso, with no visible rash, no allergic reaction, no change in detergent or skincare. Just an itch that will not stop, and has no logical explanation. When the bile duct becomes blocked by a growing tumor, bile acids that should be moving through the digestive system back up into the bloodstream instead. Those bile acids deposit under the skin. The result is an intense, relentless itch that no cream, no antihistamine, and no lifestyle change will fix, because it is coming from inside the body, not from the surface of the skin. This is one of the earliest biochemical signals this cancer produces. It can appear weeks or even months before jaundice becomes visible to the eye, which makes it one of the rare genuine early opportunities this disease offers, and it is almost universally dismissed as dry skin, seasonal allergies, or aging. If you recognized any of the signs discussed in this video, do not wait. Book an appointment with your doctor this week. Not tomorrow, this week. Early action is the only advantage this cancer cannot take from you. If you enjoy watching this video, please share it right now with someone over 45 in your life. It could be the most important thing you do for them today. Like this video, subscribe to this channel, and drop a comment below. Your support helps this information reach the people who need it most, and encourage my team and I to always put this type of video for everyone. Check our other videos on screen now.